The Singapore hospice and palliative care story is a humble one of passion and determination, a compassionate ground-up movement driven by people who care. Modern-day palliative care as we know today is administered with dignity and respect for the patient and their families.
Death, there's this Asian culture about taboo and nobody wants to talk about it or hear about it. And also, unfortunately, in the early days, palliative care was very much associated with death.
Everybody thought of death as superstitious and nobody wanted to be associated with the dying.
There were death houses in Singapore, in Sago Lane. Now, Sago Lane, as I understood it, was a road of coffin makers. And in between the coffin makers' shops were these places, the so-called death houses, which were actually run by charitable Chinese clan associations to look after the destitute who were very sick and dying on the streets. Put a roof over their heads, provided food, but I believe very little medical care and pain relief.
And we lived under the shadow of Sago Lane for many years. And because of Sago Lane, the whole sector catering to the sick and dying had been left untouched for many, many years.
By 1961, the death houses were banned. However, at the time, a new approach to end-of-life care was beginning to unfold in the United Kingdom. Dame Cecily Saunders, the founder of modern hospice care, she transformed the approach to helping the terminally ill. She successfully founded the world's first modern-day hospice, the St. Christopher's Hospice in South London, England.
It started as a community. The doctors, the nurses all get together. The doctors' wives will be registering the patients. They bought a house together and put the patients there together, you know, all that. So that is how the hospice movement started in England.
Inspired by her movement, seeds were sown in many places, including Singapore.
My father had this idea of getting everyone who was involved in it to come together. It was the infant stage of hospice care.
He was so inspired by the philosophy, and then he said, I think we can do something like that.
The government was worried about this Sago Lane experience again. So whoever asked to start, he just blocked. I said, Dr. E, what is in your heart you want to do? I want to do hospice work. Because he said that he went around out Singapore. The hospice care was so good, that the people died so peacefully.
At that moment, we did not think of the risk. We thought of how to give comfort, that's all.
The first people who came up to me after I gave the talk was Geraldine and Mary Tan from St. Joseph's Home. And Geraldine had already been trained in London in palliative care.
Emergency, they will come also, these doctors, yeah. And Marybeth anytime. St. Diego also anytime. Yeah, they were always ready to help.
Dr. Lee, Dr. Quek, and then Dr. Philip Tan. The first thing Dr. E did was that I think we sent them to St. Christopher for an experience. So that was where I'm able to know what it is like.
At the end of June or July of 1986, the Straits Times ran an article about hospice care. It was just entitled, "In Singapore, a Peaceful Place to Die." As a result of that little article, 144 letters were received.
Cynthia was the one that was the main one to get that going. She had invited a lot of people.
Anne Merriman and I attended, and we met a lot of these people who wrote in. And then we looked at one another, we thought, we've all identified a problem, a so-called gap in the service. So why don't we organise ourselves and do something about this? We decided to approach the Singapore Cancer Society and said, we want to form a hospice care group. Are you willing to take us on? The Ministry of Health actually gave its blessing to the Cancer Society to take us on as a group, and they did.
In 1989, the Hospice Care Group, founded under the Singapore Cancer Society, separated to become the independent Hospice Care Association. With the formation of HCA, they caught the attention of a very prolific figure in government. By 1992, with the support from President Wee Kim Wee, the government finally became significantly involved. Dover Park Hospice would be the first purpose-built inpatient hospice in Singapore. It was significant in that it had the support of the government. The movement was moving away from a purely ground-up initiative into the mainstream medical landscape.
We started in the 1990s with zero support from government, zero funding support. We had to form credibility. Oh, President Wee was very supportive. Every time we invite him, he will turn up, and I mean, it's very good, you know, not all the ministers will turn up even, but he will come and he spoke to us and he said, look, you cannot run it as RCC, as St. Joseph's, as da-da-da-da like this. Put it together so that there is one umbrella body. That's all he said. So then Dr. E called all four of us together. Cancer Society, because that time HCA was under Cancer Society, Dover Park Hospice, RCC, and St. Joseph's was under Catholic Welfare. So Catholic Welfare, so forth. Slowly we put the concept together, you know. It was easy because the members have all been participating in developing the hospice movement.
But as more organizations came up, it was recognized that we needed an umbrella body. And that's when Singapore Hospice Council was formed.
So having an umbrella body is always useful and will be catalyst in helping that particular sector to grow even more effective.
President Wee was right. And historically, we are the only country where we have one umbrella body representing all the hospice work